Hi, I'm Keith Reed, Interim Commissioner for the Oklahoma State Department of Health. Today marks exactly 1 year since the first COVID-19 vaccine was administered in Oklahoma's vaccine rollout. Since then, we've achieved a great deal together. More than 5 million doses later, close to 2.1 million Oklahomans are now fully vaccinated against COVID-19, and over 2.5 million have gotten at least one dose. That's not something to take lightly. This has all been possible because of Oklahomans like you who did their part to keep themselves and others safe. That first dose represented weeks and months of intense planning and preparation and kicked off our first shipment of 33,000 doses across the state. We had a lofty challenge preparing for those first doses, one that has continued throughout the vaccine rollout. We needed a way to get thousands of vaccine doses on a weekly basis, which needed to be kept at ultra-cold temperatures to where they were most needed. Healthcare centers and long-term care facilities spanning hundreds of miles across the state. Along with state, tribal, and local partners, our health department staff at our county health departments in Tulsa and Oklahoma City County Health Departments, we worked to develop and implement a flexible, tiered vaccine rollout plan that would meet Oklahoma's needs. Because of their hard work, Oklahoma performed among the top states in the nation to get vaccines out to our most vulnerable and at-risk citizens. It was first reserved for healthcare workers and long-term care workers who are on the front lines fighting the COVID-19 pandemic. And then, of course, to our 65-plus population who have been so dramatically impacted by the virus. Eventually, it was extended to additional essential workers and finally, all Oklahomans. We moved through these groups at a pace surpassing the vast majority of other states. We're incredibly grateful for the tireless work of our partners across the state and to hospital staff and medical professionals who have put in countless hours during this pandemic. It can't be understated that this vaccine has saved and will continue to save many Oklahomans' lives. It's kept many more from having to battle serious illness. As a state, let's take a moment to celebrate that. We've come a long way in the past year. Looking ahead, here's what you can do to keep yourself and your loved ones healthy. If you haven't gotten your first COVID-19 shot, vaccine appointments are available from your personal medical provider at most local pharmacies, through the state or federal vaccine portal, or by calling 211. If you're already fully vaccinated, the best thing you can do right now is to get a booster dose that will give you extra protection. A booster dose is an important part of the vaccination series to help keep you from becoming seriously ill. You can get a booster shot 6 months after your last Pfizer or Moderna dose, or 2 months after your last Johnson & Johnson dose. I want to personally thank every Oklahoman who has stepped up to get their COVID-19 shot over the past year. It's been a trying time, and because of you, we were quite literally able to save lives with safe, effective COVID-19 vaccines. Let's keep up the good work, Oklahoma.